Dr. Travis Gratton with the University Veterinary Care Center is now joining us for this week's Pet Advice. Good morning, Dr. Gratton.
Good morning again.
We are talking about cognitive decline in our aging pets, and I know that there's actually a syndrome associated with this, cognitive dysfunction syndrome. Can you tell us about that?
Yeah, so syndromes tend to be kind of catch-all categories for a lot of stuff that kind of looks the same, in general, it is largely the kind of the age-related decline in mental function, similar to Alzheimer's and Parkinson's and some of the other things on the human side. It used to be called senility, and certainly our pets, dogs and cats and others do experience it. Some classifications include some of the activity, mobility changes as well, and not just the mental, although obviously they are somewhat related.
Well, let's talk a little bit about some of the most common signs of CDS.
Yeah, so certainly the disorientation is one of the big ones. Some pets get just dazed, confused, kind of lost. They wander a lot. You have the other changes on the screen there with the interaction decreases, and that's both interaction with pets as well as other members of the house, or other pets and members of the household. The sleep-wake cycles actually are fairly common. One of the more common ones in cats, they kind of revert to being very nocturnal, wandering around, yowling, vocalizing. House training loss can certainly be one of the more disturbing ones for people, and then we do see some changes in anxiety and just general activity decreases, although occasionally we get animals who just wander aimlessly, and so their activity may actually be an increase because of they're not sure where they're at, or there's anxiety or stress and they're just wandering and pacing, so a lot of it can be very frustrating.
Oh, absolutely. Well, are these symptoms diagnostic for CDS?
In their kind of entirety, and because it is a syndrome where it's kind of a catch-all, unfortunately there's a lot of these signs and symptoms that are really not too specific. A lot of the other age-related diseases that we see with our older pets that become very common start to overlap a lot, and we really need to kind of make sure that we're looking into what those problems can be, because they also can be managed. And certainly if you just assume that, oh, we're just getting old and it's mental things, we may be ignoring some other health problems that can be addressed and help slow the progression of the decline over time.
Well, I'm sure a lot of people feel that way sometimes as well, just, oh, that's just typical, that's my dog getting old, but there are ways to treat some of this? Yeah,
and certainly with a lot of these other diseases that kind of fit in with it, the hormonal changes, the kidney problems, incontinence, arthritis, pain, and that, if we can manage some of those, a lot of times we can actually make some improvement in the portion that is cognitive dysfunction. And certainly I'd like to discuss specific treatments of cognitive dysfunction on our next visit.
Oh, absolutely. Well, and definitely if you do have some concerns, always consult with your veterinarian as far as best course of action.
Yeah, get a good workup, rule out the other problems, and then once you kind of go, okay, what's the big picture with blood work, hormone testing, maybe even x-rays, a good physical and neurologic exam, and then you can go from there and look into what the options are for slowing the progression of the actual mental decline.
Okay, well, we will continue this conversation next week. Dr. Gratton, thank you so much for being with us today. And if you'd like more information about University Veterinary Care Center, just head over to universityvetcare.com.